Hi, dear students. Good evening, all. We are in a hurry burry. NORCET is going to come within 45 days. I hope you all are preparing very wisely. You are revising everything so that I came up with a beautiful topic where you will be making mistakes. Like related to community health nursing, we all read the community aspects, national health policies, everything, but which is very important. A baby is born. Okay, a baby is born, so that initially, what after resuscitation we are going to do? So, what we are going to protect? We are going to protect the baby with what? And we have to store that medicine. We will say na that is the topic. You have to guess the topic. So we are going to give for the baby, and we are going to store in a particular place that we will name it as. Okay, anyone can tell? Is my voice is audible? No voice? Give me some time. Yes. Now is it audible? Now it is audible. Now it is audible, children. Can anyone tell me? Now it is audible. Not audible till now. Yes. Yes. Check. Check. Hello. Check. Check. Hello. Now it's coming, sir. Okay, sorry for the technical issue happened. Now, good evening all. Now is my volume, now is the audio is audible? Is my voice is audible now? Can anyone tell? Okay. Yes, now it is fine, right? See, meeting you people is like quite difficult task for me. Technical error is going to happen. It is happening. Now you can see, right? So now, as you all told, we are going to see about immunization and cold chain. It's like quite difficult task for me. Technical error is going to happen. It is happening. Now it's fine, sir. Thank you. Now you can see, right? Yes. We are going to discuss about immunization and cold chain. So why these two topics are combined here? Immunization is very important in community aspect like OBG, like in pediatrics is very important. But the vaccines, are we maintaining a proper cold chain? The storage thing is correctly properly maintained or not? In that aspect, they will put questions. Okay. Focusing on the NORCET aspect, cold chain plays a vital role here. Okay. Yes. What is cold chain? We are maintaining a particular temperature to preserve the potency of the vaccines which we are supposed to use in a precise manner. Okay. The system, what is exactly told? Just a minute. Yes. So what is here? Yes. This system used to maintain the vaccines within the recommended temperature. Okay. The range from the manufacturer to the point of administration. Till the point of administration, we are going to maintain a temperature for the vaccines, that is called cold chain. Okay. Yes. What is the purpose? To ensure the potency and effectiveness. The prevent vaccine wastage. If the vaccines are stored in a particular temperature as prescribed by the manufacturer, If we are maintaining that, the wastage is quite reduced. If it is not maintained, the viability of the vaccines is going to be reduced and it leads to wastage. Okay, yes, due to exposure to heat, light. Some vaccines will be heat sensitive. That and all we are going to discuss now. Okay, some vaccines will be light sensitive. Come on, anyone can explain heat sensitive, light sensitive and freezing vaccines? Heat sensitive vaccines is easy, OPV. Light sensitive is BCG and measles. Coming on to the freeze sensitive vaccine, anyone? Can anyone tell? Yes, good evening all. Now the volume is good, the board is good, the pen is good, everything is good. Okay, everything is fine, audible, video is visible. Only thing, you have to attend the class and listen. Yes, come on. What is the recommended temperature range? It is 2 to 8 degrees Celsius, except for vaccines requiring deep freezing. Only vaccine which we are going to deep freeze, that is oral polio vaccine. Okay, yes, hepatitis B, correct. First point is hepatitis B. Then only we can say TT and all. Okay, yes. Now we are having cold chain methods like active cooling, passive cooling, monitoring, and as well as reverse cold chain. What is this active cooling? Active cooling is some electrical equipments. Electrical power is needed for refrigerate. Okay, like needs some electrical power to maintain the cold chain for maintaining a particular temperature we are using, right? With the electrical power, if we are using, that is active cooling method. Walk-in freezers, walk-in freeze, that is walk-in coolers and freezers, ice-lined refrigerator. Like ice cream shops we are having, right? That is ice-lined refrigerator. In top model also it is available. And deep freezers. Okay, deep freezers in the sense minus 80 also it will go. Up to minus 80 also it will go. Coming on to the passive cooling method, where only without electrical power we are preserving the vaccines under the temperature, like with ice packs. Ice packs, with the help of this we are maintaining temperature, a particular temperature. With ice packs we are maintaining without electrical power, without electrical power, if we are maintaining a temperature, that is passive cooling, cold box, vaccine carriers and ice packs. Okay, coming on to the monitoring method, how we can determine whether the vaccines are stored in a fridge in a particular temperature or not. With the help of monitoring method like stem thermometer, dial thermometer and vaccine vial monitor. You all know about the vaccine vial monitor, right? Which will be placed in the top of the vaccine or in the body of the vaccine. Yes, come on, tell me. Stijita, Devi, yes, Bania Mandal, yes, now it is audible, right? Yes, correct. Thank you so much all. Yes, good evening, yes. Now, next come on to reverse cold chain method. So what is the reverse cold chain? Here, we are going to transport the stool specimen or any other specimen in with the help of this ice packs alone to maintain a temperature, like stool sample transport for polio surveillance using the cold box. Cold box, we only for transporting purpose we are using, that is reverse cold chain method. Okay, yes, that's it. Square like, yes, VVM, vaccine vial monitor, you're correct. Yes, why I took this topic in the sense, some questions they may ask, like freeze sensitive it is asked, but related to that lot of questions they may put you. For that only I made this topic to all people. So walk-in freezers, where it will be? First thing, it is national, state, regional vaccine store it is available. Coming on to this, the temperature ideally is maintained, that is walk-in freezers minus 15 to minus 25 degrees Celsius where OPV is stored. And storage duration is 3 months. And we have to monitor for VVM, that is vaccine vial monitor. Coming on to the walk-in coolers, it is having 2 to 8 degrees Celsius. Storage duration is 1 month. But what is your question is, where it is available? National, state and regional vaccine stores. Okay, yes. Coming on to the large deep freezer. Here it is minus 15 to minus 25 degrees Celsius for 1 month and district level. It is stored in available at district level. Coming on to the large ice-lined refrigerator, 2 to 8 degrees Celsius for 1 month district level. Coming on to the small deep freezer, minus 15 to minus 25 degrees Celsius for 1 month PHC level, primary health center level. Here this ILR, again it is 2 to 8 degrees Celsius, 1 month PHC level. Here what point you should know? Large ILR is having 2 to 8 degrees Celsius. ILR here also 2 to 8 degrees Celsius. Wherever come deep freezer, it is minus 15 to minus 25 degrees Celsius. Only one thing is stored for 3 months, that is walk-in freezers, and vaccine carriers only for 48 to 72 hours. Ice packs are used. One thing you should note, which is available in regional national centers, that is walk-in freezers and walk-in coolers. Please make a note. What is the temperature? If the walk-in freezer, if they are asking any freezer, it is minus 15 to minus 25 degrees Celsius. And only thing having 3 months, that is storage duration of the vaccines, that is walk-in freezers. Other than that, any freezer comes keyword minus 15 to minus 25. Other things all that is plus 2 to 8 degree Celsius. Is it clear? Is everything clear now? Okay. Coming on to the day carrier, 2 ice packs are used, only few hours, only short trips. Sub-center level it is available. Like vaccine carrier also, it is available in sub-center level. Carry 60 to 20 vials. This is the MCQ point per trip. What is the day carrier here? Only 2 ice packs we are using, few hours. Sub-center level, carry 6 to 8 vials. This is your MCQ point. Please take your note and write these 2 important points first. Then after comes, if any freezer comes, it is minus 15 to minus 25 degree. If any other, it will be like 2 to 8 degree Celsius, which is carried, which is showed for 3 months walk-in freezers. Okay. Other than that, all are 1 month. Coming on to the vaccine carriers, that is 48 to 72 hours. Day carriers, it itself tells that only few hours the viable time for the vaccines. It is available, the vaccine carriers and day carriers are available only in the sub-center. These vaccine carrier has 16 to 20 vials, 1 point. And sub-center level, this day carriers having 6 to 8 vials nearby. Okay. Coming on to the cold boxes, 2 to 8 degrees Celsius, 1 to 3 hours used in vaccine transportation to peripheral centers. Okay, that is cold boxes. Okay. Now you are going to tell which is active cooling and which is passive cooling here. Can anyone tell? Can anyone tell? Here I can say active cooling here. It is active cooling. Walk-in coolers also active cooling. Deep freezers active cooling. Ice line, that is ice line refrigerator also active cooling. Small deep freezer also active cooling. Here small ILR active cooling. These 3 are passive cooling. These 3 are passive cooling. Yes, vaccine carrier, day carrier and cold boxes are passive cooling. Here comes your question. right? This is your MCQ point here. Only one vaccine that we are going to store in deep, that is polio, -15 to -25 degrees Celsius. That is deep freezer, walk-in deep freezers. It is a freeze-stable vaccine, requires deep freezing. It is easy, right? Now, oral polio vaccine is over. BCG, what is the temperature? Anyone can tell me? What is the storage temperature for BCG? Come on, anyone? It is, that is +2 to +8 degree Celsius. Yes, correct. Where and all it is stored? ILR, walk-in coolers, cold box. Yes, 2 to 8 degree. Correct. Protect from light. Yes, correct. Priyanka, bipolar, Bandia Mandal, everyone is correct. Srijita, vlogs, correct. You are correct. Protect from light. After reconstitution, after it is going to, we are going to prepare and we are going to administer. That time after reconstitution, we have to use immediately. Okay, the two within 4 hours. 4 to 6 hours we can say, 4 to 6 hours. Coming on to this, if they ask only hours, 4 hours, 5 hours, 6 hours, 7 hours, that time you should choose 6 hours to the maximum value you should choose. Okay, is it clear? Yes. Use immediately, but at the end, within 6 hours you should use. Reconstitution, remember, very important. Measles and MR vaccines, these are live vaccines. Yes, ILR, cold box, vaccine carrier. It is also a light sensitive vaccine. Discard after reconstitution 6 hours. Same thing for BCG and measles, right? Same thing, 2 to 8 degree Celsius. Coming on to this, hepatitis B vaccine. It is also stored in ice-lined refrigerator, cold box and vaccine carrier. What you should think? OPV, only deep freezer, walk-in freezers. After reconstitution we should discard. Okay, we have to discard that. Here ILR, cold box and vaccines, other vaccines like from the measles till all vaccines we are going to store in ILR, cold box and vaccine carriers. What it tells? Hepatitis B vaccine, it is a freeze sensitive vaccine. Do not freeze, though it is a freeze sensitive vaccine. Coming on to this pentavalent again, what are the compositions here? Diphtheria, pertussis, tetanus, hepatitis B and HB, that is Haemophilus influenza B virus. Okay, sorry, Haemophilus influenza B vaccine. Okay, we are going to give that. It is also a freeze sensitive vaccine. Do not store in deep freeze. Again, ice-lined refrigerator, cold box and vaccine carrier. Storage temperature is same, 2 to 8 degree, 2 to 8 degree. Coming on to the DPT vaccine, again it is also same scenario here. It is a freeze sensitive vaccine. Now it is clear. Light sensitive vaccines are BCG and measles. Deep, that is deep freeze vaccines, OPV. Lights, that is heat sensitive vaccines, is OPV. OPV we can say two things. Deep freeze we have to do, it is heat sensitive. PCG is light sensitive. Other than that, pentavalent vaccine, hepatitis B, they are freeze sensitive vaccine. Don't confuse, please be clear. Okay, there is chances for your NORCET also. Coming on to this other thing, TT, 2 to 8 degree, again ice-lined refrigerator, cold box and carriers, vaccines carriers. It is also a freeze sensitive. Rotavirus, where we are going to give drops. Okay, again 2 to 8 degrees Celsius, protect from freezing. Pneumococcal 2 to 8 degree freeze sensitive. It is same. Japanese encephalitis also, it is a live vaccine 2 to 8 degrees Celsius. It is light sensitive. Which are the vaccines are live sensitive? BCG, now measles, and now we are adding Japanese encephalitis also. Again another one vaccine, vitamin A syrup, also a light sensitive vaccine. Vitamin A we are having light sensitive vaccine. First preference always give to BCG. Okay, first always give preference to BCG. Okay, here vitamin A syrup, ice line refrigerator only. Here we are not using for vaccine carrier and cold box. Is it clear for you all? Is it clear? Shall I repeat once again? Now we will quick discuss everything. Which is the freeze sensitive vaccine? First, freeze sensitive is first thing hepatitis B, then pentavalent we can have, diphtheria, pertussis, tetanus we can have. Coming on to the other thing, these four are light sensitive. These are light sensitive vaccine. Okay, yes. Coming on to the next, deep freeze vaccine is OPV. Deep freeze. When we talk about heat sensitive, first we have to give for OPV. Heat sensitive is OPV. Is it clear? Yes, hepatitis B. Yes, it is clear now. Five drops I told, not ml. Okay, vial it is different. Dosage administration, that is 5 drops I told. Okay, not 5 ml. Okay, yes. Coming on to this, vaccine storage in ILR, that is ice line refrigerator. Optimum temperature 2 to 8 degrees Celsius. Coolest zone, sometimes they may ask the coolest zone. Coolest zone will be bottom of the ILR. MCQ. These are very simple MCQ. If they ask you the question, you will feel whether middle portion will be the freezer or the top portion will be the freezer. In refrigerator, we all use the fridge, right? In fridge, what is happening in our home? We are having at the top, we are having freezer. If it is a double door fridge, it will be right side or left side, we cannot know. Depends upon the company, it may vary. But if ILR is there, ice line refrigerator is there, bottom part is the coolest zone. What is the storage rule? Freeze sensitive vaccines at what? Top. Heat sensitive vaccine at bottom. Okay, this is your MCQ again. Please make a note. Freeze sensitive vaccines we have to store at top, because the temperature will be high, that is very low temperature. If we keep, means the potential, that potency of the vaccine will be gone, effectiveness will not be there. Heat sensitive vaccine, it should be deep freeze, so at bottom. Okay, yes, lower part, upper part, correct. You can say like that also, top of the fridge refrigerator and bottom of the refrigerator. Okay, yes. Heat versus freeze sensitivity of the vaccines. So already we have discussed how we are going to categorize it. From freeze, top storage, first hepatitis B, first preference you have to give that. Then pentavalent, including TT, TD. Then pneumococcal vaccine. Coming on to this side, heat sensitive vaccines. First we have to give OPV, first preference, second is measles, third is BCG. Include that BCG is the live sensitive vaccine, light sensitive vaccine. Which is both heat and freeze sensitive? Come on, tell me, which is both heat and freeze sensitive? Please segregate a slide with, that's what we are going to discuss here. I have Sirija, you can see the slide here, heat sensitive, freeze sensitive, and which is both heat and freeze sensitive. Have you got the slide? See, I know what you people will thinking. Okay, this is the bond between a teacher and the student, right? Yes, you asked, the slide is next I have added, right? Yes, Sirija? Yes, come on. Come on, tell me which will be the heat and freeze sensitive. Come on, tell me. I need the answer. Let us interact this session. We will keep the session lively, okay? Because you all learned everything. Like if I shown up the slide of immunization, we all know, because from first year we are in the immunization camp. We may carry our daycare, daycare vaccines vials to the public. We are prone to get administered the vaccines, right? We people own everything, but this discussion class will help you to analyze everything, and you will be having a clarity. For clarity purpose, I have choose this topic. Okay, yes. No. DPT already we have given. It is a freeze sensitive vaccine. Yes, it is inactivated polio virus. IPV is both heat and freeze sensitive. Okay, yes. Ideal temperature is 2 to 8 degrees Celsius. Don't confuse between oral polio vaccine and inactivated polio vaccine. Okay, yes. Here comes the concept vaccine vial monitor. What we are going to do with vaccine vial monitor? It is used for, you all know what is vaccine vial monitor. If they given a picture, you will analyze. What is the purpose actually? It is used for heat sensitive vaccine only. Which is heat sensitive vaccine here? First we will give for OPV, then pentavalent vaccine, then pneumococcal vaccine. Okay, for that purpose, heat sensitivity, if it is lost, then the effectiveness of the vaccine is totally lost and it is wastage. Okay, mechanism, it contains heat sensitive chemicals. Okay, what is the placement? Sometimes they may put on the body of the vial. You can see on the body of the vial, not on the cap or neck of the vial. Okay, as per the open vial policy, we are maintaining this. Okay, what is the purpose? Only to detect heat sensitive vaccines. I think this might be your new learning for me also. Yes, because heat sensitive chemicals are there. Only to detect heat sensitive vaccines we are using this. Here we all learned lot of times with image based question. If it is totally white, we can use, or light white we can also use. If it is totally same color, outer, inner and outer, then we are not going to use that. If it is totally color change, like dark color in the inner better than the outer, then the outer, then also we are not going to use it. Only if it is white, like you people, it is like white hearted people, then we can say we can use. Okay, yes, white hearted people we can use. Little bit light hearted also we can use. If it is dark hearted, we are not going to use. Okay, is it clear? Yes. If anyone dark hearted here, obviously all over the world nurses are white hearted people, right? Yes, nurses are white hearted people. Coming on to this open vial policy, is it clear? Vaccine vial monitor, hope you guys understood everything. Chemical name and all they won't ask, I will refer, but there is no need. It contains only heat sensitive chemicals. Okay, heat sensitive chemicals, it will react to the sunlight and the vaccine vial changes. Okay, yes. Coming on to the open vial policy. Yes, first, second we can use, third and fourth we should discard. Yes, correct. a guideline allowing the reuse of certain vaccine up to 28 days. This is your MCQ. Open vial policy, open, that is reuse of vaccine up to what days? 0 up to 48 days. After opening, provided cold chain and aseptic techniques are maintained. That is open vial policy. Permitted duration 28 days. Only for eligible vaccines. We will discuss the eligible vaccine. Storage condition to maintain 2 to 8 degrees Celsius in ILR with proper vaccine vial tracking. It is very, very important. Placement of VVM, body of the vial. Coming on to this, vaccine covered under open vial policy. These are the vaccines. First, hepatitis B, pentavalent vaccine, diphtheria, already pentavalent is covered, TT and TD, PCV, pneumococcal vaccine, inactivated poliovirus and rotavirus. Optional you can keep, depends upon the manufacturer, it may vary, but these are the vaccines are allowed to use, which is applicable for open vial policy. We can reuse the vaccine unless the temperature is maintained and vaccine vial monitor is monitored, then we can use this vaccines. Okay, is it clear? Is it clear, children? Yes. Coming on to the next thing. Vaccines not covered must be used within hours. First thing, measles, rubella, okay, 6 to 8 hours. BCG, 4 to 6 hours. Already I have told within 6 hours. If the duration they have given, interval they have given, you can choose the option. If maximum value, 6 hours. For measles also you can choose 6 hours. Okay, yes. COVID-19, new update, 6 to 8 hours. Depends on the brand and instructions, but 6 to 8 hours we should use the vaccine or else we should discard. Okay, yes, not covered under open vial policy. Japanese encephalitis also, single session use only. Only single session we are going to use, then we are going to discard. Okay, yes. BCG, measles, COVID-19, Japanese encephalitis. Okay, yes. Coming on to the next test, shake test. If anybody know about shake test, what is happening in shake test? Yes, for freeze damage detection. For heat sensitivity, we are using vaccine vial monitor. For freeze sensitivity, freeze damage, the vaccine is freezed 2 to 8 degrees Celsius. If it is more freezed also, it is a problem. If it is more freezed also, if the temperature is not maintained, the optimum temperature is not maintained also, it is a problem there. Okay, it is used for diphtheria, pertussis, tetanus, hepatitis B, pentavalent and PCV, because these are freeze sensitive vaccine. Hepatitis B, pentavalent or freeze sensitive vaccine. First rank is for hepatitis B, most freeze sensitive. Okay, most, we can say most freeze sensitive. Okay, yes. Coming on to the testing principles, detect aluminum salt precipitation. Here there is a chemical reaction of heat. Here we are using aluminum. It detects aluminum salt precipitation when it frozen. You can see. Then freeze damaged vials will have freeze damaged vial, clear liquid plus white precipitate will be settled. Okay, then it is freeze, it is damaged. Undamaged vial, uniform cloudy white suspension will be there. Here in this picture you can able to know. Okay, any doubt, children? Yes, yes, freeze sensitive, it is done. Yes, correct. Isari, you are correct. According to this picture, it is a control vial. Test vial, after shake test is done, you should not shake vigorously. You should shake in an optimum manner. 5 to 10 shakes it is allowed. Okay, yes. Test vial, you can see a white cloudy appearance, then it is normal. You can use this vaccine. If you can see an aluminum salt precipitate and settled down, sedimentation is there, then You should not use the vial. Okay. Yes. Now it is clear. Yes. Then now we are going to see about the vaccination schedule, vaccine history, everything. Till now, cold chain, we have completed some aspects, everything I have told you, the concepts, everything. If there any doubt, you can ask me so that I will explain. Okay? Any doubt, children? Any doubt regarding cold chain? You want to explain me again? First, one thing you should note, you want to note that is, I will write here, any place. Yes, here we can write. Okay, what is we are going to write here? Heat sensitive vaccine. You are going to answer. I will write heat sensitive vaccines. Then freeze sensitive. Freeze sensitive vaccine. Then light sensitive. Okay. Yes. Now here again, which is both heat and heat sensitive, both heat and light sensitive, freeze sensitive, sorry, freeze sensitive. Okay. Yes, you are going to answer now. Come on, tell me. Heat sensitive vaccine, whoever going to comment, I am going to write the person's name and comment here. Okay. Yes, for freeze sensitive vaccine, shake test is used, correct. Heat sensitive vaccine is, yes, OPV. Ishari, you are correct. OPV and BCG measles. Okay. Always give first preference to OPV. Okay. First preference to OPV. Coming on to the freeze sensitive, here hepatitis B, yes, correct. Ramya, correct. Hepatitis B. Ishari, you are correct. Yes, hepatitis B, pentavalent pneumococcal vaccine. Here, light sensitive. Come on, light sensitive. Both is IPV. Yes, correct. Ramya, you are correct. First answer, correct. Manoranjita, you are correct. Yes, yes, correct. You are correct. It's sensitive. IPV, yes, correct. Here, light sensitive is BCG and measles. Now it is clear, right? Yes. Again, we are going to discuss about another one thing. Vaccine vial monitor to detect what, and shake test to detect what? Vaccine vial monitor to detect heat sensitivity. Shake test is for freeze sensitivity. Is it clear now? Okay. Yes. Okay. This point is clear. That's all about the cold chain. We have to maintain what are the aspects they are going to ask. The question is, what is the optimum temperature? Active cooling, passive cooling we have discussed, ILR, deep freezes. Anything if you find a word freezer, that is -15 to -25 degrees Celsius, which vaccines we are going to store? OPV, which is a heat sensitive vaccine. We have to deep freeze the vaccine. Whenever there is a word called coolers or any other thing, other than everything is that is 2 to 8 degrees Celsius, which are, if any electrical supply, any coolers is there, we are using active cooling method. Electrical supply will be there, like vaccine carriers, day carriers, cold boxes. If we are any transportation, reverse cooling method you are using, then we are using ice packs towards that. That is passive cooling without electrical supply. If we are maintaining an optimum temperature, that is called passive cooling method. Okay. Another thing that we have seen about the vaccine vial monitor, shake test and open vial policy, which is very, very important. if you're going for the exam, that time you will have the confusion. For that only I'm repeatedly telling about the open vial policy and all. Which vaccines are allowed? Hepatitis B, pentavalent, DPT. You can remember these are killed vaccine. You can see these are killed vaccine. Only one thing is rotavirus. Don't think about rotavirus, other than that are killed vaccine here. You just remember the keyword, which is available for open vial policy, which is not applicable. Some of the live vaccines also included. Okay, here these are live vaccines. Okay, which is the optimum hours. That is very, very important. After reconstitution we have to discard this. Okay, yes, correct. Coming on to the preferred site, that is first is always oral vaccines. Vaccine administration sequence, they will give match the following. This time very simple, match the following they will give. Which vaccines are administered first according to the preference? OPV, BCG, and what we can say subcutaneous, we can say hepatitis B. Another one vaccine, what we can say, pentavalent and measles. If they give that, what you are going to do? OPV we are going to give first, oral. BCG is intradermal, second. Then subcutaneous is third. Subcutaneous vaccines we are going to administer, that is third. And intramuscular is always fourth. Pentavalent, like specifically we are going to cover all the vaccines, then it is IM. Okay, first sequence is oral, intradermal, subcutaneous, intramuscular. Okay, it is clear? It is clear, children? Come on. Coming on to this, measles, what we are going to do? Measles, whether we will be giving in IM or subcutaneous? It is subcutaneous. Here hepatitis B is fourth, subcutaneous is 3, pentavalent is 5th. For example, I am just telling you, they will arrange accordingly, according to the preferred site they will ask. Arrange accordingly, like that there might be a question for you all people. Okay, yes, correct. Okay, shall we move on? Coming on to the vaccination history. What is vaccine? Last week we have covered immunity, right? Come on, tell me, what is vaccine? Immunity, vaccination will give what type of immunity towards us? I need exact term. You are going to answer. I need exact term. I need the exact term. Come on, anyone? Vaccination gives what type of immunity? After that, I will discuss the Edward Jenner and Louis Pasteur, what they have done. Passive immunity. Okay. Here, acquired immunity, in that active and passive. In that active we are having natural and acquired. Okay, in that passive, natural and acquired, that is artificial. Natural, artificial, natural, artificial. Here natural is actively, when we are going to expose to an infection, antibodies are developed. Natural, acquired, active, artificial immunity, that is vaccination. Why you told that is passive parental administration? Passive immunity, how you can say? It is an acquired, active, artificial. Acquired, active, artificial. Yes, correct. Coming on to this passive, acquired, passive, natural immunity, that is transferred from mother to fetus. Here, acquired passive artificial, what it tells? IG, immunoglobulins, antiserum. Again, I will discuss, okay? Because while you are attending, it will be very clear. Once, if you're not revised, then it will not be in your mind. Vaccine gives you what? Acquired active artificial immunity. Acquired active artificial. Here simple, we are having innate immunity and acquired immunity. Innate immunity, while we born, we are in birth, we are having the immunity power. Okay. Acquired immunity, we are having active and passive. In active and passive, we are having two: active, natural and artificial; passive, natural and artificial. Okay. It is clear now? Vaccine gives acquired active artificial immunity. Like that, if you remember, it won't forget. Okay? Yes. Coming on to this, Edward Jenner. Who is he? He is the founder. He is the discovered founder of smallpox vaccine. Anyone can say the year? Then who he coined the term vaccination. Vaccination. He coined the term vaccination. Coming on to the Louis Pasteur. Okay, he is the founder of smallpox vaccine in the year 1798. Coming on to the Louis Pasteur, he coined the term vaccine. He coined the term vaccine and discovered vaccines of rabies, diphtheria, etc. Okay. Yes, correct, clear? Yes, that's all about Edward Jenner and Louis Pasteur. Coming on to this, Mission Indradhanush 2024 immunization program, that is IMI 5.0. Mission Indradhanush latest updates. Rotavirus vaccine now under open vial policy. Depends upon the manufacturer, it may vary, I told, but now it is under open vial policy. Yes, correct. Third dose of fractional IPV, newly introduced, total 3 doses. Initially it was what? Usually we will give 6th and 14th week. Now 3 doses of IPV is introduced, third dose is introduced. Okay, yes. Japanese encephalitis is a kill vaccines we are using. Disease covered total is 12. Nationally 11 and subnationally it is Japanese, including one, that is Japanese encephalitis. It is latest update. Okay, rotavirus is included in open vial policy, and third dose of fractional IPV, very very important. Please make a note, children. Please make a note. Fractional IPV third dose we have introduced in Mission Indradhanush. Okay, yes, it is clear. Yes, anthrax also, but mainly we can say 1978, not 1976. Okay, yes. Here comes the important points. Okay, yes. Coming on to this, BCG, when to give? At birth. Okay, at birth we are going to give. At birth, if we are not giving within 7 days, if you are not giving, dosage may vary. What is the dosage? Come on, you people are going to answer everything in this concept, so that I have given blank. Come on, tell me. Yes, 9th month, correct. Correct. Isari or correct? We'll discuss. Coming on to the dosage, 0.05 ml. Okay, then after that, after 1 week, if you are going to administer, that is 0.1 ml. That is the dosage. What is the route here? Not 0.5 ml, not 0.5 ml, not 1 ml. Who told 1 ml? Yes. Route is what? Intra? Yes, at birth. You just do the concept 0 to 7 days. If you are going to administer, then it is 0.05 ml. After 1 week, 0.1 ml. Okay, that is the concept you should analyze. Yes, okay. Yes, until 1 month we can give 0.05 ml. Until 1 month. Okay, 1 month. Sorry, 1 month we can give. Until 1 month we can give this vaccine 0.05 ml. Till 1 year, after 1 month, if we are going to give 0.1 ml. Okay, yes, intradermal, correct. Coming on to the hepatitis B birth dose. When we are going to give? At birth. At birth we are going to give. What may be the dosage? At birth, as early as possible we are going to give. As early as possible we are going to give. Any doubts, children? Come on. Maximum age, that is within 24 hours we have to give. What may be the dosage? Come on, anyone? What may be the dosage for hepatitis B? Yes, within 24 hours. Correct, correct. Isari, you are correct. What is the dosage? Same, 0.5 ml. What is the route? Hepatitis B. Easy, right? Now it is intramuscular. Here, left upper arm and scar is formed in BCG. I forgot to tell, a scar is formed to identification. For identification purpose, a scar is formed. Okay? Yes, a scar is formed in a rotatory manner. Okay? Anterior-lateral side of the mid-thigh, that is hepatitis B. Left, that is left side. It is left upper arm, mid left thigh, anterior-lateral of the mid-thigh. Okay? Coming on to the OPV0, oral polio vaccine, the free sensitive vaccine. When we are going to give this? Come on, tell me, when we are going to give this? Come on. At birth we are going to give. Again, at birth. At birth, what vaccines we are going to give? BCG, hepatitis B and OPV. Yes, within 15 days. If it is missed, within 15 days. How many drops? 2 drops. Okay, diluent. Sorry, for BCG the diluent is sodium chloride. Okay, here no diluent we are going to use. What is the route? That is oral. Okay, that is oral. In BCG, I will repeat once again, don't worry, we will revise, but we will see that. OPV 1, 2 and 3 at 6, 10 and 14 weeks. Yes, correct. 6, 10 and 14. Rotavirus vaccine. Again, we are going to see about rotavirus vaccine. When it is given? When it is given, again it is same, right? Any doubt, children? Yes, purple color scar at birth, 2 drops oral. Yes, come on. It is easy now. We are going to finish it soon. Again, 6, 10 and 14. What is the maximum? Till 5 years we can give. That is the maximum duration. If it is missed, we can give. Till 1 year for rotavirus. Again, it is 2 drops here. For rotavirus, it is 5 drops. Again, it is all oral. No diluent is mixed. Is it clear? Same. It is clear. Okay, don't confuse between 6, 10 and 14. Okay? Yes. I will repeat once again. Okay? Yes. BCG, again. Yes. BCG, at birth we are going to give diluent, that is very important, 0. That is 0.05 ml 1 month, 1 month, 1 month. Okay, don't confuse. I have told initially 7 days. No, it is 1 month. After 1 month, that is 0.1 ml, not 1 ml, 0.1 ml. Okay, route is intradermal. Sodium chloride is the what diluent. Site is upper left arm. Scar is formed, that is purple color scar for easy identification. Other than that, hepatitis B birth dose as soon as possible. We are at birth, we are going to give. OP also as soon as possible we are going to give. Okay, it is 6, 10 and 14. Other dose 6, 10 and 14. It is oral. Only thing, it is 2 drops. It is 2 drops, and till 1 year we are going to give this rotavirus 5 drops. Okay, yes, it is clear. Yes. Going to see other vaccine, inactivated polio virus vaccine. Okay, inactivated polio vaccine. At what age we are going to give this? Come on, tell me. Inactivated polio, 6 and 14 weeks. If it is fractional IPV, at 9 months we are going to give. At 9 months, fractional IPV, 3rd dose. Okay, yes, up to 1 year, 0.1 ml, that is the dosage. No diluent we are going to use. Okay, what is the route? That is not oral. Sorry, what is the route? It is subcutaneous or IM. Come on, tell me, inactivated will be subcutaneous or IM? Inactivated will be subcutaneous or IM or any other thing. Yes, it is intradermal. You guys learned everything. Right upper arm. Left upper arm is BCG. Right upper arm is IPV. Okay, intradermal. Pentavalent vaccine 1, 2 and 3. Again it is 6, 10 and 14. Correct? Till 1 year. This is for infants. Okay, infants. Okay, 6, 10 and 14 weeks. 0.5 ml. No. What is the route? IM. Anterolateral side of mid-thigh left. Okay, polio goes for right, pentavalent goes left. Okay, remember like this. Measles first dose, that is, anyone can tell measles first dose? I am waiting for the command. You can also command soon. Yes, come on. No one commented, right? Yes, yes, I am correct. Correct, Ramya, you are correct. Yes. Coming on to the measles first dose, when we are going to give? Yes, 9 to 12 months. Always 9 to 12 months. Coming on to the Japanese encephalitis first dose. It is given at what months? Japanese encephalitis also given at what month? Come on, anyone? Come on, anyone? It is 9 to 12 months. Again, it is 9 to 12 months. Coming on to the vitamin A first dose, it is also 9 completed months. 9 completed months. Okay. Vitamin A for infants. For infants, I am telling, for infants till. Okay, it is 9 months. Where we left? From measles, we given till 5 years. Measles till 5 years. Okay, 0.5 ml. What is the diluent here? Sterile water. Yes, right upper arm. Here also IPV, it is also right upper arm. Japanese encephalitis. What is the route here? For measles, what is the route? It is IM or subcutaneous. Come on. For measles, it will be IM or subcutaneous. Can anyone tell me? Yes, same. Come on, tell me. 9 to 12 months. Correct, correct, correct. What is the root for measles, Japanese encephalitis? It is, yes, correct, subcutaneous. For vitamin A, it is oral. Japanese encephalitis also. Japanese encephalitis and BCG are given in left upper arm. Okay. Japanese encephalitis, BCG are given in left upper arm. Other than that, this inactivated poliovirus, measles, and other thing, only these two, right? IPV and this measles vaccines are given in right upper arm. Right upper arm. Yes, correct? Yes. Even remembering everything is very difficult, but you have to, okay? In this Japanese encephalitis, what is the diluent we are using? That is phosphate buffer till 15 years. Coming on to the vitamin A, first 9 completed months, here there are differences, but vitamin A only 9 completed months, till 5 years we can give 1 ml equal to 1 lakh international unit. Okay. No diluent are used, oral. Okay. Vitamin A we are going to give. Okay. Is this clear? Yes. Coming on to the next children category from 1 to 5 years. Yes. DBT booster dose 1. When we are going to give? At 16 to 24 months. What is the maximum age? 7 years. Up to 7 years we can give. Dosage is 0.5 ml. Diluent, no diluent. What is the route? Come on, DBT booster dose. Diphtheria, pertussis, tetanus booster dose. What is the route? Come on, anyone tell? I'll be waiting. Fractional IPV dosage given for left upper arm. Is it left upper arm? 9th month we are going to give. I think yes. Yes. You are correct, Ramya. Yes. It is given at left upper arm. But fractional IPV first we are going to give at right upper arm. Okay. Inactivated. I have not talked about fractional IPV here. Only IPV, that is inactivated polio vaccine, which is available in the national immunization schedule. That only we have discussed. Okay. Fractional IPV is totally different. Okay. Yes. Yes, it is DBT booster. That is IM. Left anterior lateral, mid left thigh. Okay. Coming on to the measles second dose. Again, we are going to give at 16 to 24 months. Till 5 years, 0.5 ml, sterile water. Route is subcutaneous, right upper arm. Okay, yes. Coming on to the OPV booster dose. When we are going to give this OPV booster dose? OPV booster dose, come on, tell me. OPV booster dose, when we are going to give OPV booster? It is same, right? Again it is 16 to 24 months. Till 5 years, 2 drops, no. Route is oral. Is it clear? Yes? Yes, it's clear. Japanese encephalitis second dose. You are going to answer Japanese encephalitis second dose. Which time we are going to give? Again it is same, right? Again it is same, 16 to 24 months. There is no upper limit we can give. What is the buffer? Phosphate buffer for Japanese encephalitis. JEPB. Phosphate buffer. Left upper arm. Okay. Vitamin A second dose to 9th dose. First dose we have given 16 month. Then every 1 month, every month 1 dose we are going to give. Till 5 years, 2 ml, 2 lakh international unit. After 16th month, every month we are going to give that the dosage is 1 lakh. That is 1 ml we are going to give. No oral route. No diluent. It is oral route. Coming on to this DPT booster dose 2. Can anyone tell DPT booster dose which time we are going to give? That is 5 to 6 years. Okay, till 7 years maximum age limit, 0.5 ml, no diluent we are going to use. Left upper arm, it is given what? Which route we are going to give? That is IM. Again TT, it is a prophylactic dose. At which time we are going to give? That is 10 years and 16 years. 2 doses we are going to give. No upper age limit, 0.5 ml, no. And come on, which is the route? That is IM. It is clear, right? Yes? Yes, come on. Yes, correct. 5 to 6 years the prophylactic dose. 10 year and 16 year, 2 doses we can give. Now tell me, vaccines comes under which type of prevention? That is a question here. Vaccines comes under which type of prevention? Come on, vaccines comes under which type of prevention? Yes, primary prevention. Okay, correct. Coming on to the pregnant woman category, TT1, TT2 and TT booster, that is tetanus toxoid, we are going to give the dosage. Okay, early in pregnancy, 0.5 ml, same. No intramuscular we are going to give, and upper arm. Second dose, the major point you should note, 4 weeks gap should be there between first dose and second dose. Okay, 28 days we have to give gap. And 0.5 ml, same dosage, and intramuscular upper arm. Coming on to the TT booster, if they received any TT in pregnancy within the last 3 years, only booster dose is enough. Only booster is enough. 0.5 ml, intramuscular upper arm, same thing. Okay, yes. Primary prevention, specific protection. Yes, right, Ramya, you are correct. Good to see your answers. Till now we have discussed everything, right? Now we are going to practice MCQs. At last, with one-liners, we will wind up. Okay? Are you ready to answer the MCQs now? We will study. Upper arm, which side? That is not mandatory thing in TT vaccines. In either right side or left side we can give. Okay? Irrespective of arms we can give. That is too applicable. Okay? Which vaccine requires deep freezing for storage? Okay? See, if they are their dominant ant is right, that time we can give left. That is too practicality, but there is no such guidelines for giving vaccine in a particular right. That is upper arm they have given. Okay? Yes. Now tell me, what is pentavalent hepatitis B and DPT? DPT is what? Pentavalent is what? Hepatitis B is what? OPV is correct. What about the distractors? What about the distractors? Yes, they are freeze sensitive vaccines. This only deep freezing vaccines, correct. At what temperature should DPT vaccine be stored? Minus 25 to 30, that is 15 to 30, 25, 8 to 25 degrees Celsius, minus 20, 2 to 8 degrees Celsius. Yes, correct, freeze sensitive, come on. Coming on to the next question. At what temperature should DPT vaccine be stored? It's easy, right? It is easy. Which equipment is used for vaccine storage at sub-center level? Sub-center level, whether we'll be using deep freezer, walk-in freezer, cool box, ice-lined refrigerator. See, why you are given D? D and all will not come. Medical rhythm, it is wrong. And Srija, why you have given D here? Come on, see. DPT vaccine, it is a freeze sensitive vaccine. Only one vaccine we are going to store at minus 15 to 25 degrees Celsius as per our immunization guidelines, vaccination guidelines. See, OPV is minus 15 to minus 25 degrees Celsius. Okay. Other than that, no vaccines can be stored. Okay. It is clear? Yes. DPT vaccine will be stored. Other than that, all vaccines are stored at 2 to 8 degrees Celsius. Remember like that. Here, what is the answer? Yes. Cold box. Other than that, deep freezer, walk-in freezers, ice-lined coolers will be in regional hospitals. Here, primary health center will have this ice-lined refrigerator, walk-in freezers also. Okay? Yes. Which of the following is light sensitive? Now tell me, which of the following is light sensitive vaccine? Light sensitive vaccines are which of the vaccines? Come on, tell me. Yes, Neelam, Soni, Ramya, everyone, you are correct. Now tell me. Yes. Light sensitive. It is easy, right? Yes. BCG vaccine is the light sensitive. Any other vaccines are light sensitive? Any other vaccines? Any other? Yes, measles. After reconstitution, these vaccines are discarded within how many hours? Within how many hours? That is, come on, tell me, within how many hours? No, not hepatitis, BCG, measles are light sensitive vaccines. We can include Japanese encephalitis also. Yes? Okay. 6 hours, not 4 hours. If they ask you interval based measles is 6 to 8 hours. For BCG is 4 to 6 hours. Okay? Yes. The vaccine vial monitor indicates temperature maintenance of the vial, freezing point of the vial, heat exposure history of the vial, light exposure of the vial. Now tell me. Now this question may be controversial for some people. Let you people can answer. Let me see. Yes, heat's exposure history, because it is having heat reactive chemicals. Okay, whether it is exposed to heat or not, the vaccine vial monitor is supposed to do. Okay, yes, it is clear now, right? Yes. Which vaccine must be discarded 6 hours after reconstitution? 6 hours after reconstitution. Hepatitis B, pentavalent, BCG, tetanus toxoid. Here it is very easy question. Okay, for your understanding purpose I have given, for your easy clarity I have given very easy, because it is easy to understand. Okay, now discarded in the sense BCG. If they given measles, then it will be a confusing for you people. Okay, like that, in the examiner point of view, if you think, then you can answer each and every questions. Okay, yes, it is C. Next question we will go. We will see the next question. Is it fine, children? Which equipment is lined with frozen water to maintain cold during power failure? Come on, anyone? Power failure? Yes. Ice lined refrigerator. What it does actually? Ice lined means like it will be like here water are filled, right? Water are filled and it is freezed, and there will be a temperature maintenance will be there. Okay, that is temperature maintenance there. So answer will be C. Where and all it will be like, we can say which areas and all Iceland refrigerator are placed. Whether it is placed in subcenter, whether it is placed in subcenter or primary health center. Whether it is placed in subcenter or primary health center. Now another one question from this MCQ. Whether it is placed in subcenter or primary health center. Yes, PHC level. It is the correct answer. Coming on to the next question. The correct temperature range for vaccine storage in ILR. It is easy now. You will answer, I know. It is 2 to 8 degrees Celsius. Already we have discussed a lot of question. PHC, district regional center. Yes, correct. It is easy question. Okay. What does reverse cold chain refers to? Vaccine transport, blood storage, specimen transport to laboratory, ice pack production. See, from vaccination, they will give cold storage, everything they will give direct one-liners only. You have to mug up everything. Like you have to remember like tricky questions, like tricky mnemonics you can form, and you have to grab everything. For that only repeatedly telling cold chain, what is the mechanism, vaccine vial monitor, what it exactly does. Okay, you have learned about the image based question regarding vaccine vial monitor. Okay, yes, yes, it is specimen transport to laboratory. Yes, it is correct. Now, at what age is the BCG vaccine ideally given according to the national immunization schedule? BCG vaccine ideally given at 6 weeks, at birth as soon as possible, at 9 months, at 10 weeks. Now also it is easy question. You will answer, I know. It is very easy question. BCG is given at birth. Now here comes the question. What is the dosage? If the baby is more than 1 month, then what will be the dosage? Come on, tell me. What will be the dosage if the age of the baby is 1 month, more than 1 month? Yes, correct. 0.1 ml. Yes, correct. Sirija, Vinu, Muva, Sirisha, all are correct. You are correct. 0.1 ml, 0.1 ml if the age is greater than 1 month. Okay? Yes. What is the maximum permissible age to administer OPV 0? Here comes the question. 0 dose. Maximum age. Maximum time we can give. Okay, come on. Here It is 7 days, 30 days, 15 days, 6 months. Dose 0. Yes, it is 15 days. Okay, it is easy. Some important vaccines alone, you just may make remembrance of the maximum duration, maximum age limit, like that. If you remember, it is very easy. Okay, 15 days will be the answer. Okay, next question. That's all. Now we are going to see about important one-liners, right? We are going to see about the one-liners. Launched year, that is Universal Immunization Program, launched in the year 1985. What is the target group? 1985 it is started. Which is the replacement for EPI, that is extended, okay, immunization program. Okay, immunization program, and it is Universal Immunization Program. Okay, focuses on pregnant women, infants and children up to 16 years. Up to 16 years. Yes. Goal is to provide free vaccines. These vaccines are provided free of cost by the government. Okay, against vaccine preventable diseases under Universal Immunization Program. Which are the conditions? This is or it is going to prevent. That is 11 conditions plus 1. It is nationally, that is about regionally, we can say Japanese encephalitis also, plus 1, we can say totally 12 diseases it is going to prevent. Okay, yes. Program integration. Universal Immunization Program is the part of National Health Mission. Okay, National Health Mission. Schedule basic follows the National Immunization Schedule issued by the Ministry of Health. This point you should know, it comes under National Health Mission, and under Ministry of Health the schedule is followed. Is it clear? Yes. Is it clear? Is it clear? Okay. Next question. What are the diseases covered? Now you are going to answer. Okay, now you are going to answer. What are the diseases covered? Okay, it is difficult to type. Okay, we will play a game. Each one type one disease condition. If measles is there, then another one condition you should also type. Okay, we are going to play a game here. Which vaccine, which age, diseases are covered under immunization program? We have told 12. Accordingly, you have to answer that 12. Okay, we are going to play that. Come on, tell me. What are the 12 disease conditions related to that vaccine? Starting from first. At birth, what we are going to give? BCG covers what? TB, polio, diphtheria, it is over. Okay, is or correct? Next. TB is given already. Other than that, polio is given. Sirisha, come on. BCG, TB is going to cover. Okay. Poliomyelitis, again it is coming same. Measles is good. BCG, I am not asking about the vaccines. Which are the disease condition it is going to prevent? Which are the disease condition is going to prevent? Yes. Rubella, okay. Japanese encephalitis, measles. Again, see, you are not thinking beyond that. Okay, pentavalent vaccine, what it is having? Come on, type diphtheria, pertussis and tetanus. 3 disease condition over. Again, hepatitis. Then again, what is going to? Haemophilus influenza. Okay, influenza disease condition. Then coming on to the BCG, tuberculosis. Coming on to other, that is mumps, measles it is going to prevent. Then MMR, mumps, measles, rubella we can say. Other than that, Japanese encephalitis. Okay, we can count nearby. Now these 12 vaccines, like tuberculosis first thing, polio 2, diphtheria 3, pertussis is 4, tetanus is 5, measles 6, hepatitis B is 7, Haemophilus influenzae 8, rotavirus 9, Japanese encephalitis 10, rubella and pneumococcal infections, these are comes under 12 vaccines we are going to give. BCG given at birth protects against tuberculosis. OPV, first dose as birth, then 6, 10 and 14. Pentavalent given at 6, 10 and 14. Okay, DPT is covered, hepatitis B and Haemophilus influenza B virus. Measles, rubella, first dose at 9 to 12 months, second at 16 to 24 months. 16 to 24 months. It is clear? Yes. Diarrheal diseases, rotavirus. Yes. Beta retinol. Correct. It is clear? Yes. Coming on to this, vitamin A supplementation, where you will be having the confusion here. Okay, started at 9 months, 2 lakh international unit. Okay, continued every 6 months till 5 years. Continued every 6 months till 5 years we are going to give. Okay, yes. Okay, yes. Then I have told wrongly, I hope. 6 months once we are going to give. I told monthly, I hope. Sorry for this wrong information. Okay, monthly once we are not going to give. Every 6 months, 1 lakh international. The dosage is 1 lakh. 6 months we are going to give. Okay, first initial dose is 2 lakhs. After that, 16 to 24 months we are going to give another dose. After that, every 6 months we are going to give 1 lakh international unit as per the guidelines. Okay, yes, that is the vitamin A dosage. Okay, at 16 months we are going to give. After that, 16 months we are going to give the second dose, 1 lakh international unit. Every 6 months we are going to complete the dosage. Is it clear? Yes. Yes, line minus, correct. Rotavirus vaccine administered only at 6, 10 and 14 weeks to prevent diarrhea. What is the most common cause of diarrhea in children? In infants, if the question comes, that is rotavirus. If most common cause of death in children, that is pneumonia. Okay, it is clear? Yes. IPV vaccines given at 6 and 14 weeks via intradermal route. Okay, via intradermal route, IPV. Okay, yes. It is clear? Diarrhea will be the most common cause in infants. Okay, most common cause is infants, I am telling, not about children. Death is pneumonia. Okay, that's all for this today's session. Any doubts? Worldwide, yes, worldwide I am just asking. Yes, pneumonia will be the death. In India, if we specifically say, that is diarrhea. Okay, yes, correct. Any doubts, children? You want to explain me anything? Regarding immunity, I will just explain you again. Don't confuse here. Everyone is having the same doubt. Okay? Regarding immunization, immunity. Where is it gone? Regarding the immunity, we are having innate immunity and acquired immunity. In acquired, we are having active, passive. In active, we are having two: natural, artificial. Natural, artificial. In natural, our body will be exposed to an infection, to antigen. Against that antigen, antibodies are formed. Antibodies are formed. Here, artificial if we take through vaccination. Again, I will tell passive, natural, that is from mother to fetus. Here, that is through Ig, immunoglobulins. Okay, this concept is clear. Now, last class, you people have a doubt regarding one question, that is reasoning and assertion, primary prevention, like TT administration during wound management is secondary prevention. Secondary prevention, what is the reason? Secondary prevention holds the screening of disease and prompt immediate action towards the disease condition. What may be the answer? Japanese encephalitis is the root. Initially it is subcutaneous. Okay, Japanese encephalitis is always subcutaneously we are going to administer. Okay, Japanese encephalitis is subcutaneous. Okay, Japanese encephalitis is subcutaneous. Okay, subcutaneous route. Come on, tell me the answer. Primary prevention. Okay, secondary prevention, they have told the reason. TT during wound management is secondary prevention. Whether it is correct or wrong? Come on, tell me. No, it is subcutaneous. We can give right upper arm. Okay, Japanese encephalitis left upper arm will give. Left upper arm only will give. Okay, left upper arm only will give. Left upper arm. Japanese encephalitis BCG will be giving left upper arm. Fractional IPV also in the left upper arm. Next. So don't confuse here. Okay, for prevention it is quite understand. It is easy only. Let me complete this question first, then I will discuss the doubts which asked by the students last week. Okay, yes. Yes, this what you people are making mistake. Secondary prevention. No, it is not like that. Okay, TT we are giving for what? Wound management. We are not going to give TT. If TT occurred, we are going to do the treatment. Tetanus is identified, then we are going to treatment. Early to do not occur tetanus, we are giving TT for preventive aspect. Wound management is the sense wound is occurred. Okay, soil, there will be tetanus will be there. Okay, for that preventive of tetanus we are giving TT. So it is not secondary prevention, it is primary prevention. Okay, if you put that in a Google, it will tell secondary prevention only. Okay, once you referred the book, a standard book, once you referred, it is clearly given it is primary prevention. Okay, TT we are administered for the patient to prevent what? Tetanus. A wound patient is coming to a casualty. Okay, you are posted as a nurse in that casualty. Doctor told, do the dressing, give TT shot. First we'll be asking the history to the patient. Which time you got your TT last? Last TT which time you got? If it is more than 6 months or 1 year, definitely we are going to give the TT. TT short is to prevent TT. It is not to prevent the wound. Wound care is different. TT administration, that is the keyword you should note. TT administration is secondary prevention or not. That is the keyword. To confuse you, they may put you the question. Okay. Primary prevention is we are going to give TT. Okay, vaccination, all type of vaccination comes under primary prevention, not secondary prevention. Okay, screening, any screening we are going to do for 10 members in a hospital. Okay, 10 members in a particular area, they got an RTA, road traffic accidents. They came to an hospital. You are posted as a nurse. Doctor telling to put TT first. Wound dressing is done and mild abrasions only is there. We are going to give TT for the patients. Okay, then you will tell that is a secondary prevention. Whether the doctor screened everything, whether this patient is out of 10 patients, 5 patients are prone to get TT, 5 patients are not prone to get TT. So first 5 patients you give TT, sister, like that. If he or she told, that time it is primary prevention or secondary prevention, whether screening is done. So irrespective of screening, we are preventing the victims to prevent from tetanus. That is the point. Okay, primary prevention is wound wash. I am not talking about wound wash or anything. I am just talking about TT. It is secondary prevention or not. That is the point. Okay, yes. Yes, now it's clear, right? Again, second doubt. Another student asked about BP monitoring. Here, BP monitoring is there. BP monitoring plays a vital role in primordial prevention, primary prevention, secondary prevention, and tertiary prevention. Okay, yes. BP monitoring, if we take in primordial prevention, no risk is identified. If no risk is identified, we can say it is primary prevention, no risk. If risk factors are there, we are monitoring BP with risk factor, then it is primary prevention. If it is secondary prevention, BP monitoring is there, secondary prevention, risk factor is positive plus mild symptoms, then it is secondary prevention. Coming on to the tertiary prevention, if they got the disease like complications of hypertension, stroke, hemorrhage, anything like paralysis, anything, if we are monitoring BP with the disease condition, then it is tertiary prevention. So depends upon the situation, it may vary. Okay, yes. Okay, yes. Is there any doubt, children? We'll wind up. We'll wind up. Come on, tell me. We'll wind up the session. Any doubts? Yes. Once again, exam is near. Please concentrate on your study. Practice more MCQs. Have a small note with you. Keep your notes safe and go through your notes. Once you're done, your revision is the key for the success. Once you practice more MCQs, you will gain more knowledge. Okay? Yes. Thank you all. See you next week. Bye. Take care.